My name is Gail, and I'm happy to give a testimonial for AdCare and tell you how it relates to my son Kellen and what it has done for him. Kellen, as an infant, always had issues with sensory type problems, which we never attributed to anything. We just thought they were his little quirks. And some of those were clothing that bothered him, seams on socks that had to be exactly straight before the shoes could go on, and many times it took 15 minutes or more to get the shoes on with the socks properly situated. Seams on shirts had to be just right, and if Kellen was put into a car seat, if there was any wrinkle in the back of a shirt, he would scream and cry until we got him all straightened out. Anytime there was the least amount of wind blowing, he had to have a sweatshirt with a hood up and on and over his ears because the wind bothered him. And he was extremely sensitive to loud noises. All of which, as I said, we didn't really attribute to anything. Along the way, starting in elementary school, we started hearing from his teachers that he was having some learning problems, problems not being able to follow directions, and not being able to repeat back. He would hear a story and then he couldn't sequence the story back. A lot of these things we weren't really seeing at home when there was just a one-on-one situation. It was at that time that we first had Kellen tested. This was first grade. He was about 6 years old. We took him to a psychologist who tested and said he was fine, and just to keep an eye on him, which is what we did. In second grade, his teacher also noticed a problem, pertaining mostly to the fact that he was a little bit distracted and could notice what other kids were doing all the time. And this teacher put him in isolation. A little corner by himself, surrounded by some file cabinets with some headphones so he could tune out the external noises and get his work done. When I heard what was going on in class, I was a little concerned, but when I found out that Kellen actually liked being put by himself and isolated like that, and that his work was getting done, I felt a little bit better about it. This went on through school. In third grade, also a problem. At this point, we started seeing some physical issues. Kellen could never spin around on a swing like the other kids. He didn't like anything that would make him the least bit dizzy. And in talking to another parent, I started seeing that maybe there were some occupational therapy type problems, some actual physical problems. At that point, we spent several months working with an occupational therapist who helped with a lot of the physical symptoms, but there were still some learning problems. Now we're into third and fourth grade. Another problem that we ran into was some auditory problems, and we went through auditory integration, which was desensitizing hearing for certain tones. At the end of elementary school, in about fifth grade, homework was becoming quite an issue because we would sit for hours to get homework done when the other kids would get it done within 45 minutes. During middle school, we noticed an extreme problem with getting homework done. And it wasn't so much the fact that homework wasn't getting done as Kellen wasn't remembering that he had homework to do. And I believe it was at this point that the anxiety started to set in. When he would go back to school in the morning and the teacher would request that homework be turned in, Kellen would go into a panic because he realized that the homework had not gotten done from the night before. And organization was becoming quite a problem at this point, or lack of organization. Kellen always had the locker and the desk that had the big black hole in it. If anything went in that locker, it never came back out. Anything went in the backpack, it never came back out. So we were starting to notice lack of organization and time management skills. The first year of high school, we realized that Kellen was suffering from some true physical disabilities. He was diagnosed at that time with ulcerative colitis, which came from stress and the anxiety. And being diagnosed with that only added to the stress and the anxiety. And it was through high school that Kellen himself really started noticing that there was a problem, that his friends and his classmates were getting their work done and were able to get their assignments turned in on time, but he was not able to do that. There were a few OCD components that came into play during this time, and huge time management issues that came into play. Even though he's very artistic, the photography and art classes were the ones that he was doing the poorest in. Assignments were not getting turned in because they weren't being completed to his satisfaction. Along the way, I truly believe that Kellen fell through the cracks because he did not have the typical ADD symptoms that most teachers look for. He was never a disruption in class. He was never disrespectful to the teacher. He never got out of his seat. He never talked excessively. And so, because he wasn't the troublemaker kid, he really fell through the cracks. Right before he was due to graduate from high school, about 2 months prior to graduation, was when we found Jeff Gaisley, and Kellen was finally diagnosed with overfocused ADD. And it was at this time that there was really a question as to whether he would actually graduate, because the grades had dropped to a questionable point. Jeff finally was able to diagnose Kellen and get him on Adderall at this point, and immediately we saw a huge difference. The anxiety level decreased, and at this time, for the first time, I believe, in Kellen's school history, he got an assignment turned in on time, when it was due, without anybody having to remind him constantly that he had homework. The Adderall worked great for probably a period of about a month, and then started backfiring a little bit. Kellen got a little more anxious. He almost felt speedy. He's very thin to begin with, and he was losing a lot of weight, and it just wasn't pleasurable for him anymore. He was seeing the side effects rather than the benefits. And at that point we decided to switch to the AdCare and see what that did. AdCare immediately was a boost. It helped the same way that the Adderall had in the beginning, but it decreased the anxiety a tremendous amount more. We saw immediately that Kellen was able to slow down and think logically and thoughtfully through a conversation rather than his mind jumping from subject to subject all the time. His whole demeanor changed. He was much calmer and able to focus. I'm happy to say that he did graduate from high school on time with his class. And he actually just finished his first college course, English 101. And although the final grades aren't in yet, we do believe he's either gotten an A or a B in that class. And every assignment was turned in on time without anyone nagging and telling him that he had homework to do, because he's now in college and he was able to take care of that by himself. And I truly believe that was something that would not have happened if not for AdCare. For more information on AdCare, please go to their website, www.add-care.com. Thank you.